there's just so much.
You're listening to a Mamma Mia podcast.
Oh, hello there. It's me, Claire Murphy. We hope you're enjoying well and our current exploration of all things skin in our last 4 episodes. Look, we've explored all kinds of things like anti-aging, skin conditions like eczema, psoriasis and rosacea, and we have that all-important skin cancer chat. Yes, I'm looking at you, which is so relevant to all of us as Aussies and how best we can protect our skin from dangerous UV radiation. And we've answered a ton of your questions about your own skin concerns too. So in this episode, we're sharing a mid-conversation with Dr. Naomi. Now, she's a cosmetic doctor, and this is quite a refreshingly honest conversation about our relationship with our faces. Dr. Naomi discusses her own facial work and the kinds of beauty treatments that she sees coming through her clinic.
What's wrong with your face? That's easy. Absolutely nothing. What do you think is wrong with your face? That's easy too. Absolutely everything. My top lip is disappearing. My eyelids are falling into my eyes. My eyebrows are thinning. My sunspots are spreading. There's more baggage under my eyes and under my arms. My forehead is a game of noughts and crosses. I've got lines pointing down to my lips. This is you talking about your faces when I asked you. And of course, me talking about mine. If I was being really honest sitting here, I'd be like, oh, my neck is drooping, my chin is AWOL. Depressing, right? That we can all find so many faults in ourselves. Well, yes, but also no. After all, whose fault is it that we swim in a soup, as I like to say, of beauty standards that really all have one benchmark, and it's youth, young, taut, tight, smooth, even. It takes the willpower and self-resolve of a busy saint not to ever worry about what time and age is doing to make our outsides look so different from the way we feel on the inside. I'm Holly Wainwright and I am mid. And today I'm putting judgments, and believe me, I have plenty of them, of course, almost all directed at myself, on the shelf. And I've invited someone who's in one of the fastest growing industries in the world. That's the cosmetic treatment industry. These days it's usually called aesthetics, which is a word I always struggle to say, but she's in aesthetics. What she's seen and what she would suggest that we all do about that laundry list of perceived faults that you sent me. Because we're answering your dilemmas here this season on Mid, as you know, and I'm calling smart women to help us solve our problems. Remember, this advice about your faces is only relevant if you want to do anything to them, if you can afford it, if you're happy to step into that world and onto that Ferris wheel. But if you met Dr. Naomi, who's called Naomi McCullum, but she almost always is just called Dr. Naomi on Instagram and everywhere else in real life, you'd have no idea how old she is, but you would be able to tell that she's done quite a bit of work to her face, and she has absolutely no shame or shade about it, and nor should she. It's her business, it's her world, she's obsessed with it. She sent me, because I asked her, and she very politely said yes, sent me a list of all the things that she's done over the years to herself, because she says she's been a cosmetic doctor and a cosmetic patient for 25 years now. And remember, she wouldn't describe her approach to all this stuff as moderate or ordinary or anything. But just deep breaths. Listen to this. This is the list that Dr. Naomi sent me. Rhinoplasty at least 6 times. That's a nose job, friends. Tummy tuck times 3. An upper bleph. We're going to tell you what an upper bleph is. Breast reduction 2, maybe 3 times. Lipo 8 times. That's liposuction, including arms, legs, trunk, neck, most multiple times, she says. Face and neck lift, hair transplant times 2, lip lift times 3, jaw widening surgery, orthodontic, she says, arm lift. She also says every non-surgical procedure many times, full body freckle and mole removal, ablative laser, full field and fractionated, and of course, injectables. Now, Naomi says that she doesn't have any plans for any more cosmetic surgery for about 7 years. But the thing is, if that's shocking to you, and of course it is, and you're like, how are we talking to this person about like what I would call ordinary in inverted commas people, which is people who aren't going to go that far, She runs a clinic that she's been running for a long time now in Sydney's fancy eastern suburbs and also one in the city that do all kinds of beauty treatments. And because she's lived and breathed this for so long and it's her world and she's obsessed with it, she knows everything about it. And she is refreshingly honest and non-judgmental about it. Obviously, I was like, oh my God, I'm sitting next to a woman who has done all kinds of things to herself in terms of chasing perfection. And I use some fancy serums sometimes. I've had a bit of laser, but that's where it stops for me so far. But she's actually very non-judgmental. Of course, there are a lot of kind of moral and ethical questions that swirl around in this world and certainly swirl around in the world of cosmetic surgery. But that's actually not what we're here to talk about today. What we're here to talk about today with Dr. Naomi, who knows a lot of stuff firsthand and as an expert and qualified practitioner, are the questions that you sent in. And she is unflinchingly honest about it. She's also going to tell you why you should never take a picture of Kris Jenner's new face into a cosmetic doctor and say, I want one like that. No. Instead, she's going to spill the face secrets of the brave, the loaded, the just plain curious. And please note, friends, as we've told you before when we've talked about this kind of stuff, here in Australia, we're lucky enough to be bound by pretty strict rules when it comes to discussing and certainly promoting any specific cosmetic procedures or health treatments. So if you wonder why the good doctor is being a little bit vague at times, that's why. Enjoy. Naomi, thank you so much for joining us today. So I asked the mid-audience, I said, send me your dilemmas about your face. So no one's telling you that you need to have dilemmas about your face, but if you do, send me some. Do you think I got a lot or a few?
I think we all know the answer.
I think I got a lot, didn't I? Some of them are very specific and some of them I've kind of grouped together because these are the things that the audience wanted me to ask you as the expert in this space. So here's the first one. It's juicy. My dilemma is about money, writes our listener. You're not an accountant. She means you. You're not an accountant, Naomi. But you know how much all this stuff costs. She means beauty stuff, obviously, and tweakments and so on. And like a lot of women, I'm very tempted by fixing some of the things that are making me sad when I look in the mirror. But I'm not sure that financially I can justify spending that on my face. Can you give me an idea of how much the most common anti-aging procedures cost and what women are spending on their faces?
Probably the most common amount that people would spend would be those who do their upper face wrinkles. Mm-hmm. So they treat those and they do that 3 times a year, spending about $800.
Yeah.
That's a really common scenario.
So $800 each time?
Yes.
Yeah, right, okay.
That's very, very common. But then, upwards from there, tens of thousands for some people.
What do like the most into it people spend?
Oh.
Like who are you?
I'd hate to even add it up.
Customers?
I mean, there's people who just come every month for something.
Yeah.
Or even more frequently.
And do you think, is it one of the things that people often say is they're like, oh, I might start with this, but then I'll get to that and I'll get to that. Is that true?
It can happen.
It can happen. People can get carried away. Related to this, someone says, if you could only spend, actually this sort of almost fits into what we were talking about, but if you could only spend between $500 and $1,000 a year on skin treatments, what would you spend it on?
Could I have 2,000?
Okay, let's double that budget because let's break it up,
Sure.
Yeah.
So I think 2,000 is a bit easier for me. I could probably pull it back, but let's just start at 2 and go down. I'd probably do a wrinkle treatment twice a year and then I'd do the rest at home. So I'd do home peels, I'd get a home LED and I'd do regular things at home myself. And obviously sunscreen and that type of thing too.
Is there a line where, because I think that one of the things that lots of women around my age are like, I love a bougie serum, right? I love that. So I probably spend more than I should on the promise in a bottle. But there's a point at which the bottle isn't going to cut it. Am I correct?
You are.
And so if I'm spending hundreds of dollars on skincare, is there an argument that I might be better off transferring some of that money into other more serious is the wrong word, but, more heavy-duty treatments?
So it depends on what you're trying to improve. So different treatments will treat different things to what skincare will do.
Of course, I guess that's true. So when I say I just want to generally look young and gorgeous, it's not in a bottle? Okay, this next one. I want to get tweaks, but my partner would be so disappointed in me if I did. Is everything women get done obvious? Do lots of women manage to hide this stuff from their partners? Do you think that's okay? Now, I know you're not a therapist, Naomi, but you must have seen everything. Tell me about the kind of things that women get done and try and keep secret.
So women hide it all the time. So they hide the downtime, they hide the financial aspect. So they'll put it on 3 cards. They'll do it while the husband goes away. So yes, they hide it.
Because if you're getting certain things done, it's going to show. Obviously, that's kind of the point.
And the downtime.
And the downtime. Do you think it's okay?
Which part of it? Hiding it?
Yeah, I guess she's sort of saying like lots of women manage to hide it? And do you think it's okay that they do? What do you think?
I think people should be in charge of their own bodies and their bodies are their business as well. I mean, if it was a really risky procedure, I think it's important to share that with your partner.
Do you think that it's lessening, like in the time that you've been in this business, do you think that kind of stuff, that kind of, oh no, what do you mean? I just had a good night's sleep stuff is fading out?
There's way less hiding it, so much more transparency.
You think that's good?
Yes.
Because you know how now it's very common for, say, celebrities to go online and say, I did this. I mean, we have stricter regulations in this country for people to be able to do that. But, you know, you'll see an American celebrity go online and say, I had exactly this. This is my surgeon. This is how much of the stuff I got, blah, blah, blah. You a big fan? I mean, you've always marketed your business that way with lots of transparency.
Yes. I think it's an improvement.
Is the problem that people come to you with these pictures of celebrities and go, make me look like that?
It's difficult when the patient expectations are too high.
It's like at the hairdressers, except with your face. Okay, here's a good one. My partner is 10 years younger than me. We've been together for 15 years and adore each other. It's never been a problem, but now I feel like I'm aging fast and I look so much older than him. If you could recommend the most effective and not too obvious procedures that would freshen me up, I would love to know what you'd choose.
Okay, this lady needs a consultation. So one thing doesn't suit everybody. Every face is different, and not just the anatomical part. So we have to follow the medical procedures. So take a history, do an examination, have a discussion, get a consent. So from the anatomy point of view, we're going to look at her and see something very different to someone else. So for example, she might have her mid-face aged more than the rest of her face, so we're going to focus on that. She might have a really beautiful part of her face, like gorgeous eyes, and we really want to keep them amazing. So everybody's different anatomically, and everybody has a different risk tolerance, budget, downtime tolerance. So we really have to get into that with everybody before we make a plan. So it's a bit hard to give a plan.
Yeah. If I was to come to you, to your clinic for the first time, and just say, and I'm not asking you to do a consultation on me, that would be inappropriate.
Yeah.
But like, I want to kind of understand the process.
Okay.
So I would come in and I might say to you, look, I haven't been doing anything, but I'm really I'm really feeling I'm aging around my eyes and forehead or my jowly neck or whatever. And we're going to get into specifics soon. I would see a professional. They would listen to my concerns. They would say you could do this, this, and this. Is that how it works?
So we'd first talk about what you were concerned about, and then we'd just do an anatomical assessment. You actually have beautiful proportions.
Thanks.
Yeah, you really do. So you'd need sort of, depending on what you wanted, but yeah, a global sort of thing. So because your proportions are
when you say global, you mean?
So it means that looking at you're nicely, evenly proportioned, and there's not one area that is. It's all looking nice together.
It's all as old as each other.
You probably started out with really nice proportions. So, yeah.
Okay, so you'd come in, I'd see a professional. They would give me a very individual.
Yes.
Now, what should people watch out for when they're doing that kind of thing? Because if I've never done that, what I'm scared of is A, it would be emotionally crushing because someone's going to sit there with a pen and tell me all the things that are wrong with my face. These are my preconceptions. So you tell me if they're real or not.
Yeah.
B, they're obviously going to want to upsell me because they're going to be like, well, you could do this for $2,000 or you could do this for blah, blah, blah. And how do I know that they've kind of got my best interests at heart, if you like? So what should you be looking for when you're looking for a practitioner?
So what I think you should do is go in with your boundaries and then share them. So this is my budget. This is my concerns. This is my downtime. This is my risk tolerance. The risk tolerance you'll really have to talk about once the practitioner has talked to you about the risks. So you just set it yourself.
So risk tolerance, you mean in terms of how much of an operation you might want, like what you're willing to, how far you're willing to go almost.
Yeah, so we'll do things where the risks are temporary. So a brow droop, a lid droop, bruising, swelling, that type of thing. Then we'll do a little bit higher risk, well, catastrophic risks still at a low risk, but they're there. So things like blindness, necrosis, so quite serious risks. And some people just don't want that. So we'll just that's ruled out.
And a good clinician should be honest about that stuff up front and honest about that stuff.
Well, we're obliged.
Yes. Yeah. So they shouldn't be like, no, it's nothing.
No.
Yeah, a bit the other way, really, if anything. You're like,
you need to give informed consent.
Yes, of course, right? After the break, I'm going to be doing something a little bit mortifying and asking Dr. Naomi about the lines that have taken up permanent residency on my face. And if I wanted to do something about it, what would it be? We'll be right back. So I want to ask you, when I ask the mid-audience about their faces, and I always want to come from a place of telling everybody, like, you're beautiful, you do you, but there were some very common areas of their over 40s faces that they wanted to know about.
All right, let's go.
I hate the lines around my lips. I could have written this. I hate the lines around my lips. I think I gave up smoking when I was like 28, and I'm like, is this the cost? Is this the cost of those years? Anyway, I didn't write this one. I hate the lines around my lips. How do I get them fixed without getting a trout pout?
That's really simple with quite a simple procedure. So a lot of people talk like this. So they pull in and we can use a product that will stop you doing or minimize you doing that. And yeah, it doesn't give you a trout pout at all, but it does reduce the lines.
Because it's a very common area, isn't it? Is it the smoking that gave me these once upon a time?
Could be the smoking and the way you talk.
Damn it. Eyelids. Oh my God. I got a million dilemmas about eyelids. How do you lift them? How much? What's recovery like? How long does it last? These were the questions people asked.
Okay, with the eyelids, we've got to work out, is it the brow? Is it the lid? And that's really important. So if it's the brow, we can lift that a little bit by stopping you pulling down with the muscles. So we can do that really easily and quite a low-risk procedure. With the eyelids, if it's more of a surgical case, so the lids are coming down, eventually it's going to be a medical problem. So the lids are going to come down over the pupils, so you won't be able to see. So yeah, it's a great aesthetic area to do because you're going to need it eventually anyway.
So that's what a lot of women would say, that they're like, suddenly I've got like wrinkly testicles on my So that's what you're talking about. And you can get a sort of lift there.
So,
and I don't know if you're allowed to say this or not, but is this what I see everywhere on the internet is called an upper bleph?
Yes, I am allowed to talk about this.
Good. Tell me.
So an upper bleph is an upper blepharoplasty. So it's where they do an excision of the upper eyelid in the crease of the upper eyelid.
Right. So sort of in that crease where you put your dark eyeshadow.
Yes.
Is they just cut a little bit out of there and lift it up a bit. Is that basically what an upper bleph is?
Correct.
Right.
And they sew it back together.
So you basically have a sort of a cut there and they close it up. And what is that like in terms of downtime, recovery, and whether it's a permanent fix?
So nothing's permanent in cosmetic because we continue to age, but you'd get 10 years out of it. So it's probably the surgical procedure that we refer for mostly out of anything else. So it's really common.
I'm seeing it discussed a lot. And is that partly because, as you say, like ultimately that will become a medical problem so people can kind of feel okay about it? I mean, they should feel okay about anything, but you know.
Should.
But a brow lift is a bit different.
No,
a brow lift
different.
is about lifting this part, right? And is that a surgical thing or is that an injectable
Either
thing?
way, it can be non-surgical or surgical.
Okay. All right.
Do you want me to tell you the downtime of the upper
please.
blepharoplasty? So the upper blepharoplasty downtime is about 7 days.
Okay.
So it's pretty quick and the satisfaction rate is really high for a surgical procedure.
So you could take a week off work really and get that one done. And how much does it cost? Ish.
So,
I don't mean necessarily what you charge, but broadly speaking.
Oh, no, we don't do that procedure, but I've seen it cost anywhere from $2,000 to $15,000.
Right. So it just depends on the practitioner. Okay. This is very useful. So we've done lines around the lips and eyelids. Oh no, crepey neck. Another one I identify with. Not my words. Can you solve a crepey neck? And if so, as above, how much? How serious a procedure? And what's recovery like?
Okay. So basically the patient's going to have to choose how invasive they want to go. So anywhere from skin care to home care to in-clinic devices to in-clinic injectables to surgical procedures. So basically you've got to work out your budget, your risk.
There's a spectrum.
Yeah. So it's such a variety of things.
When I think about a crepey neck, I think about a couple of things. I think about the lost elasticity, so like it's loosening.
Yep.
But also sometimes the skin itself gets that, you know, I don't want to use derogatory terms, but like that turkey skin.
Yes.
Can the actual turkey skin texture be fixed?
We can improve skin texture a lot, yes.
Right. I know you said it's a spectrum, everything from injections to a surgical procedure, but what works? Like,
the most invasive are usually the most effective. Yeah.
Which would almost be a lift.
In terms of tightness, that will be the best, but skin quality, you really do need to also work on the skin.
Now, I know you probably can't speculate about this, but when we look at some of the women in Hollywood who are like 60 and look 40, often that's part of it is this very defined jawline. What are they doing?
I think they've definitely had neck lifts, facelifts.
Yeah. So a neck lift would be at the far end of that crepey neck situation, and a bit of injections and working on the skin texture would be at the other end. Great. Thank you. This is another interesting one. Under eye area looking hollow and dark, because for a lot of women, they feel like they look tired all the time. As you age and you lose that volume there, and they might not even feel tired, but they look tired and it makes them sad.
And people say things to them as well. It's like allowed to say, oh, you look tired.
Exactly. They can't say, oh, you look old.
No.
But they'll say, you look tired. Are you all right? Can you do anything about that hollowing out under the eyes?
Yes, we can replace volume.
What do you do?
So that's something that's going to be hard for me to talk about.
Okay.
So some people could do fat transfer in the area, or you could use other things to replace volume.
And is it quite common?
Very common.
Very common.
Very common.
And good results?
There are complications associated with under eye treatments. Yeah.
Very sensitive area.
It is fine skin.
Up next, what does Dr. Naomi think about those celebrity high-profile facelifts that everybody's Googling and taking into doctors' surgeries? Jowls. We already discussed this. That's the neck lift situation. Are ordinary people really all getting facelifts these days? Everywhere you look at the moment, somebody's saying facelift, deep plane facelift, blah, blah. Tell me about them. Do they happen?
So ordinary people want to look good, don't they?
Also, ordinary people is a strange term, but I think they mean like not famous and like wives of millionaire types.
Yeah, I think it's really common.
Do you think it's like, has the way that they work kind of improved or something? Like, I don't know, has a facelift thing changed a lot over the years, or is it still the same procedure it's always been?
I think doctors, non-surgical and surgical, have become better at face design and looking at what's actually happened during aging and then trying to reproduce it and doing a better job at that.
Okay. So you think that we've kind of just got much more sophisticated?
I think so.
Because, Hollywood starlets were getting facelifts in the 20s, but I can't imagine what that was.
Wow. Pioneers, thank you.
I know, goodness. Okay, this is my nosiness really. And I don't know if you'll be able to answer me or not.
Okay.
What's a procedure that, because you know how everything sort of once seemed like it was the preserve of Hollywood stars and millionaires' wives, as I say. What's something you think that everybody's doing now that's like kind of the preserve of the few that everyone will be doing in a few years?
Oh, I feel like it doesn't necessarily work that way.
Oh, tell me.
I think there's a lot of, well, your words, ordinary beauty achievers doing these innovative things at the same time as everybody else. Yeah, I think that it's always been that way.
And you think that it's not like a trickle down where people are whispering about it?
I don't think so, no.
Well, then let's put it this way. What are some of the sort of newer, more exciting things you're seeing in anti-aging that, or, aging better or whatever words we want to put around that?
So I can't go into it too much, sadly, but the regenerative things. So your Reduran and some other types of things.
What's Reduran?
Reduran is the salmon DNA.
Now, Lee Campbell told me a little bit about this, but I don't think I understood quite what we were talking about. Can you talk me through that?
The most popular area for it is under the eyes.
And it works because it stimulates what's there?
The collagen.
Yep. Okay. So that's one of the things I could do for my hollow under eyes.
They're not that hollow, actually.
Oh, thank you. And what trends are you seeing in terms of what women are coming to you and your clinic about?
So people really want to be natural. They want really good skin. They're not really freaking out about aging. They just want to look great.
So it's not that they come in and say, make me look 30 again.
No.
They're saying, just make me look good for where I am. That's good.
Yeah, and sometimes it's just a specific thing. So people just can have one area that bugs them in particular, so you help with that. Some people are more generalised, but...
How do you feel about aging?
I'm grateful for aging, and I'll just do all the procedures.
And which you have for a long time.
So I did it more for beauty when I was younger.
Yes.
Yeah, rather than for aging, but I'll do everything for aging. I'll do it for content.
Yeah, which you do. Well, do you think it's that thing? Do you remember ages ago Kim Kardashian said something like, I can't remember what the quote was, but it was something like, I'd rub dog poo on my face if they told me it would make me look younger. Do you think that when you say that women are coming to you and are saying that I just want to have good skin and I want to look good, they're not saying I want to look younger, they're saying I want to look good?
I think they want to look younger, but it's not an obsession. It's more they just want to look great and natural and fix certain things.
Because you started having procedures early because, it's your world and as you say, you did it for beauty, did it kind of preempt a lot of aging stuff? As in, do you think they kind of held that back?
I don't know. I don't think a lot. Yeah, maybe.
Is there anything you're too scared to do?
You know what I'm scared to do, and I'm dying to do it. It's not even, it's sort of cosmetic, but it's not. It's I want to get lens implant, so a lens transplant for my eyes.
What does that do?
So I don't have to wear glasses.
Oh, you mean like...
And I'm too scared.
Really?
I'll have any cosmetic procedure, anything, but I'm scared of that.
That's so interesting.
Yeah.
Your glasses are really great, by the way.
Thank you.
You don't need to get rid of them. And what do you think when people... And I'm definitely guilty of this because I'm a bit... I have this ongoing battle with myself, and this isn't a philosophical discussion, but I'm just interested on your perspective. I have this ongoing battle with myself about like... Accept yourself, right? Like, stop looking in the mirror and picking out all the things that you hate or don't look like they did 5 years ago. Like, to me, I kind of almost set that as a bit of a challenge to myself versus, no, I don't like that. I should fix it. Do you think there's like two types of people?
No, I've got a rule for patients. So my rule is just be happy with what you have at the time and think, okay, well, maybe I want to change that when the time comes that I have the budget, the downtime, the risk tolerance, I'll just do it then. I'll wake up one day and then I'll do it, but be happy with what I have until that day and then have it and then be happy. Just always be happy because, why not?
Do you think our expectations of what can be achieved have become a bit ridiculous?
Yes.
Do you have women who come in and say, I want to look like I did when I was 30?
I think so. People who work in cosmetic will all be a bit annoyed with the filter use in the before and afters. Like, like Kris Jenner's facelift, for example. It's not going to look like that in real life. And so that's a bit annoying.
So when the Kris Jenners of the world come out, and she's 60-something?
7?
Maybe
I don't
older,
know. Yeah.
But she suddenly looks like she's wearing a new face. Is that good for business or bad for business?
I think it'd be really good if we saw more realistic photos, that's all.
Rather than just presenting here's me and it's already been like tweaked and edited and right.
That'd be better for our industry.
Because then people are like, but I don't look like Kris Jenner. And you're like, Kris Jenner doesn't look like Kris Jenner. Yeah. It's interesting because celebrities do play a big part in this in a way, in that I think about all the Generation X celebrities that I've grown up alongside, your Jennifer Anistons, your Gwyneth Paltrow's, your whoever, and you can't help but compare yourself to them. What's your advice?
Stop comparing yourself to anyone, celebrities or otherwise.
Do they also is there like an echelon there that have access to a lot of stuff that probably will filter down to the normal people?
I think it's their job, so that's different. Yeah. When beauty is your profession, it's a bit different to the rest of us.
Yeah, those of us who just would like to feel good about the way we look.
It's really different.
Okay. We're talking obviously about older women, but what about younger women? Women seem to be getting treatments, tweakments younger and younger, perhaps. I don't know if that's true. What do you think about that? And also for mothers of like young girls who maybe are looking at their mothers getting treatments and all those things. Do you think that's become complicated?
So there are some areas on the face, some specific areas which are really great to prevent issues with. So a few of those areas would be frown line, crow's feet, wrinkles, and also platysmal bands.
What are platysmal bands?
Okay, so the neck bands are the bands that go down the front of your neck. Some people have 2 at the front, a couple more at the side, and if you clench your teeth, they poke out. And these shorten as you age.
I see.
Yeah, so if you can put effort into prevention of that, the rest of it we can. And also another thing here can be some people just have some mils of fat there. So there's a few areas where it is important to get onto things early.
To the point of whether or not if your mum is doing all of this anti-aging in inverted commas and you're seeing that, like, do you think that that's become quite complicated?
In what way?
Well, I wonder if it makes young women fear aging more. Or they think, like, my mum looks the same age as me. You get a lot of people saying that now with people with treatments and tweakments becoming more common, that there's kind of like a generic age that everybody looks. It's like somewhere around 38. Do you think that's true?
Oh, I don't know.
You don't want to generalize about that.
No. With the mother and daughter thing, sometimes just the beauty achievement might even run in the family, it looks like to me. So if the mum's motivated, the daughter can be motivated that way.
I want you to explain the term beauty achievement to me.
So I guess it's just people's motivation to change things or to improve things in their mind.
Right. So
From an aesthetic point of view.
So some people are more motivated to do that.
Yes.
Whether for whatever reason.
For whatever reason.
And their reasons are their own. But if they're focused on beauty achievement, as you're saying, they're more likely to obviously invest both time and money and effort. Should women be trying not to express themselves to make their faces move less and get fewer wrinkles?
So I've seen patients who do that.
Oh, what do you mean?
So they train themselves to not do it. I mean, I could not, but I have seen that.
I had this like epiphany moment of, oh, this is why people do it. Because you can't talk without moving your forehead. But what you're saying is that some people are training themselves to not move their face too
animatedly. It's a very rare thing that I've seen, but I've seen people who are that motivated that they can do it. I couldn't.
What is the one procedure you have done that you are like, that is the best thing I've done?
Hair transplant.
Wow.
Hair transplant.
So did you get your hairline lowered? Is that what you did?
So I got it reshaped.
Tell me about that.
Okay.
And tell me why and what that takes, because that sounds like a lot.
So being a cosmetic doctor, the problem is you just see results of amazing procedures all the time. So one of my patients, a trans woman, so I've been treating her for a long time. She looks incredible, so super feminine. She's just amazing. And so she came back after having a hair transplant. And I just thought, that is just sensational. You look so beautiful. Where'd you go? I'm doing it now.
Wow. And why did you want to have it done?
Because I saw the potential from seeing her before and after.
What did you not like about your hairline?
So I thought that I didn't like the height of my forehead, but then I didn't even know until after the procedure that actually it was the width of my forehead that was going to be improved so much.
So what happens? How do you do it?
Okay, so what they do is they take a shape of an eye piece from the back of your head, cut it out. Then there's 6 technicians sitting around and they cut it all up into either 1s, 2s or 3s little hair follicles.
Wow, that's so detailed.
I know. I was there for 8 hours twice.
Yeah, wow.
And then they basically map out your new hairline and dot where the individual follicles are going to go and then implant them.
I reckon lots of men get that done.
Oh, it's really common. The results are amazing.
I see men in the public eye who are aging well and you think, your hair looks better than it did when you were. What's the downtime on that? Must be significant.
Oh, it's the most tedious procedure ever because
waiting for hair to grow is tedious anyway.
You look terrible. You look really weird. So you have this weird tiny little hairs poking out all around here and then I can't remember, maybe for about a month and then they fall out and then you just maybe a couple of months later you grow little hairs.
Little baby hairs?
Yes.
And how long till you got the result you wanted?
So, you've got to wait for that hair to reach
the rest of your hair?
Yeah.
It's like, I can imagine. So it's a long game.
It's once it's done though, amazing.
Awesome. That's really interesting.
Random, sorry.
Random, but I like it. All right, I've got one more thing.
Yeah.
A lot of us, as discussed by the audience, they're worried about their eyelids, their necks, their under eyes. Do you think, and I know you don't, this isn't a critical, but you obviously look at women's faces in a very trained eye way, right? The way that you said to me, you're very symmetrical or whatever you said. What do you think is the most aging thing? Because I remember a makeup artist once said to me that she thought that less than wrinkles, uneven skin tone, for example, was a very aging thing that you should try and focus on fixing. And that was interesting for me to hear that because it just made me realize that a trained professional looks at your face in a different way. Do you think there's something we don't realize is aging that is aging us?
Oh, That's really hard. I mean, we really look at eyes a lot. That's when we do look at eyes. So I think, and then from afar, we're not just looking front on, so we're looking side on. So it's the neck.
Whereas we tend to look at ourselves front on a lot.
Correct. So, yeah.
That's why you sometimes get that shock when you see yourself in a mirror. I mean, in a window, when you're walking past a shop window, you're like, oh.
Yeah. And I think when you're not really focusing, you're sort of looking at volume and contours and things like that. So, it all adds up.
Thank you very much, Naomi. This has been very enlightening.
My pleasure. Thank you.
And I know you join me in telling our audience, like, don't worry about things you're not worried about, but talk to a trained professional about anything that you are. Is that the message we're leaving them with?
Be happy.
Thank you, Mids, for being with us through that. I hope you found it really interesting. I did, and I hope you're enjoying this special Dilemmas season of Mid. If you are interested in all things beauty, and if you also want to hear about things that don't involve any needles, then you might want to go back and listen to my conversation with Lee Campbell. We talked about all things face and aging and beauty in our last season, but it was everything from makeup to serums to skincare to creams, all that stuff. And also she told us about the salmon sperm stuff that Dr. Naomi was talking about. She told us she'd done that. So scroll back in the feed, listen to that. It's so good. Lee's just a legend. Thank you for being with us on Mid. If you love our show, please review, please share, please tell a friend. And we want to do a big shout out to our team who help us put this together. The executive producer of Mid is Naima Brown. Our senior producer is Tali Blackman. And we've had audio design by Jacob Round. See you next week.
If you are after more women's health news, Well is your full body health check, and we drop every single week on a Thursday. We're very consistent like that. Coming up in our next topic, we're going to be talking about addiction, and we mean to a bunch of stuff. The usual suspects: alcohol, cigarettes, drugs like cannabis and meth, and all of those, including prescription drugs too, because not every drug is illegal. And we're also going to dedicate an episode on how to support someone, like maybe one of your loved ones who might be going through a substance abuse issue as well, because it's really important, because it can be such a major life impact. So Dr. Mariam and I are looking very forward to having you, so make sure you tune in next week to Well. Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.